We begin tonight with new information on variant strains of COVID-19 found in Colorado.
Yeah, doctors are trying to learn more about these mutated versions of the virus as the state picks up the pace of vaccinations. Colorado's numbers so far are small, only 57 cases. 41 of those are the so-called UK variant, first detected in the United Kingdom. There are 16 cases of the California variant, which experts believe is driving the surge in that state.
Give us concern that they might spread more easily, perhaps cause more severe disease, decrease the effectiveness of treatments or vaccine, or perhaps be harder to detect using currently available diagnostic testing.
Now, the uncertainty surrounding these strains is part of the reason there is such a sense of urgency to get more people vaccinated. We do have team coverage for you tonight with Karen Morfitt looking at additional help on the vaccine front. We begin with Alan Janae, who is looking at the research being done on those strains and joins us now at National Jewish Health.
Well, Karen, the state says we're not seeing an increase in the frequency of variants, and that is the good news first. But the bad news is, while Colorado and the United States generally are doing better in going after COVID, many months from now, variants could arise in places overseas that don't have good vaccination programs. Then they could come back ashore and maybe to Colorado.
You know, we're fighting a war and we're trying to understand how the enemy might be changing on us so that we can adapt our battle plans.
Dr. David Buther at National Jewish Health says viruses are always changing, like the handwritten copy of a book, altered each time.
To keep case numbers down, you'll get far less innovation by the virus.
Yeah, this is a race.
The CDPHE talked about tracking changes in an online discussion.
We feel like we have pretty decent coverage in the state right now to understand and screen for these variants, specifically the B117 variant, which is, I think, really the variant that we're most concerned about in the U.S. right now.
The UK variant can show subtle differences in nasal swab tests that can ring alarm bells, calling for deeper genomic sequencing, a read of the barcode of the virus. National Jewish, though, is working on a simpler test that could go nationwide.
They already have a preliminary test that, they're working through how to detect variants that should be available shortly.
The best answer, though, is limiting cases to give the virus fewer shots at evolving.
We've just had so much infection and so much viral replication going on throughout the world that eventually, there's going to be a change that's big enough to be meaningful. And that's really what we're starting to see.
The three most worrisome variants right now all have mutations to that spike protein on the surface of the virus. Remember, that's what our current approved vaccines go after. But Dr. Buther says here at National Jewish Health that if you get the vaccine, you are most certainly going to be far better off and far less likely to end up here in the hospital. In Denver, I'm Alan Janae, covering Colorado First.
Alan, thank you.